Hello, health heads. Welcome and thank you for checking in to this dose of the healthcare uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, what's on our agenda for today, Heather?
So this is our first roundtable event ever, which is really cool. And so we're bringing back two previous interviewees, Dr. Casey from Revitalize Ketamine Clinic, and also Leigh Call, who is our human story, our first human story, who is a ketamine patient. And also we're adding to the mix Sherry Race, the CEO and founder of Enthea, who is focused on building networks of ketamine provider clinics and offering them as a workplace benefit.
Yeah, and she's replacing Jessica Tracy from episode 1. Dr. Casey was episode 3, and Leigh was the bonus episode between episodes 4 and 5. So this will be the fourth and culminating episode of our ketamine series, ketamine therapy series.
Yep.
Cool. Yeah, and this one's a lot of fun. So strap in and hold on. Without further ado, here is our first ever roundtable talking about ketamine therapy.
Hi, and welcome to the Healthcare Uprising podcast. Today, we've got our first roundtable ever. So, this is really exciting. This one's on ketamine therapy. And so, we've got three folks here on the show today who I will just briefly run through. And then we're going to have everyone give kind of a brief summary of their background, their role. But we designed this roundtable discussion so that we have a few different vantage points. So, first, we have Sherry from Enthea, who is really more like the business side, employee benefits, and bringing the kind of the ketamine provider clinics together into a network that's accessible. And then we have Dr. Casey, who has a clinic here in Flagstaff for Revitalize. And then we have Leigh, who is our patient, our human story of the ketamine clinic, actually one of Dr. Casey's patients. So that's really kind of the gist here today. So, Sherry, if you would just give us a really quick intro about who you are and in your role and why you're here today.
Sure. So thanks for having me. My name's Sherry Race. I'm the CEO and co-founder of Enthea. And as you mentioned, we're really bringing these innovative treatments like ketamine therapy to employers by creating a provider network and medical policies. I'm also the director of something called the Psychedelic Research Group, which is a nonprofit. I am an advisor to the California Institute of Integral Studies, which is a university that teaches people psychedelic therapy. And I am very passionate about reducing human suffering and committed to doing that. And I'm an avid runner and addicted to chocolate. So that's a little bit about me.
You can't go wrong with chocolate.
I got that same problem with the chocolate.
Awesome. Thanks, Sherry, for joining us. And also, just side note, Jessica Tracy from Enthea actually joined us for our first episode on Healthcare Uprising. And so Sherry has come back to represent for this roundtable. So thanks for joining us today. Yeah. Next, Dr. Casey, if you would do a quick intro and background, we'd appreciate it.
Yeah, absolutely. Thanks, Heather. So I'm Casey Dubovic. I'm a psychiatric provider. I'm a psychiatric mental health nurse practitioner and operate, same as a lot of psychiatrists. I'm not a medical doctor, clear about that. State of Arizona, we're completely independent practice. That being said, I've been in healthcare since 2004. I worked in the ICU, CDICU, pre-op PACU, as well as inpatient, outpatient behavioral health units, trained in electroconvulsive therapy. I worked at the local community mental health center, and I was the only child provider for a couple years over there. I got real jaded on the traditional psychiatric treatments and that, kind of just making people less everything, in large part. And so really been following the ketamine space since around 2009 and opened our first clinic in 2021. We have clinics in Flagstaff, Sedona, and Prescott Valley. I'm also the founder of Rocked Wellness Bar, Revitalize, Optimize, and Harmonize Clinic and Therapeutics, and co-founder of Epic Biosciences. And so I love what I get to do. I'm helping people help themselves, which is so rewarding. I tell people I'm not the healer. I'm just turning the key and getting out of the way, helping you remember how capable you've always been. And it's been just, I get the chills like every day at work, especially compared to coming from traditional psychiatry, which in large ways was kind of soul crushing, to be frank.
I love that.
There you go.
That's great. Thank you for coming back. We appreciate you being here. And I forgot to ask you, do you two know each other actually from the work that you're all doing? Sherry and Dr. Casey, have you ever met before?
We haven't met before, but actually, we are in the process of talking to Casey about bringing
Ah,
together a network. So,
love it.
yes.
Well, I figured that might happen at some point. So
Awesome.
Right.
the demand, right? You have to get the
Um,
clients and then you move into that market. So awesome. Well, we're all going to make friends here. Leigh, who actually is a friend of mine, thanks for coming back and joining us on the roundtable. Just give us a quick intro and background.
Sure. Yeah, my name is Leigh Call, and like Heather said, I was a patient of Casey's. I'm a success story for the use of ketamine, and I am more than happy to advocate for it and be here to, you know, show the world that it is successful. So I'm glad to be here. Thank you for inviting me.
Awesome.
Thanks for
Yeah.
coming.
Yeah.
Yeah.
This is great. So, with that, like we always say, we like to keep things pretty loose around here, and we'll just kind of see where our conversation goes today, especially with having a group like this. So, and I will say this too, the ketamine, all of our ketamine episodes have been pretty much our highest downloaded so far. So, there is
Oh, wow.
clearly a lot of
A
interest, which
lot of
is
interest.
so cool. I will say every single one that has published so far, which is all Jessica with Enthea, and then Dr. Casey, and then Leigh, our first human story bonus episode. Um, the amount of questions and feedback and just people reaching out to me saying, "Wow, I didn't know that. That is so cool." Just, you know, the level of fascination and interest is definitely out there. So here we
That's good
are.
to know.
Yeah.
Yeah.
Yeah. Yeah, there really is. And you guys, having this platform with the podcast and, and we're just like one little piece of the world right now, we're trying to grow it, but this is certainly a good platform for us to talk about it and hopefully bring it to more people and maybe normalize it a little bit. So yeah.
Yeah, it's been super cool to like listen to Jessica's a couple times and I've listened to Lee's a couple times. I only listened to mine like halfway, but I love Lee's story just so much. Like it's just so real, and just like that vulnerability of like, hey, like like I did this because I heard about it, and then like it kind of stunk. I didn't really like doing the treatment. Right. That's so cool. And it really spoke to a lot what Jessica said, like so much more about what you do afterwards. And
Hmm.
man, like you coming like the hemisphere coming back alive, like
Hmm.
the way you described that was so cool. Like I love your
Oh,
story
yeah.
so much.
Yeah,
That's
definitely.
what
I mean, obviously, I had kind of gone into the situation just, I had no idea what to expect. So I probably went in with zero expectations, which was probably a good place to start. But like the experience alone was just, it's almost like undescribable, even though it seems like I was able to kind of describe it for people, which was good. But yeah, it was pretty awesome too that it was just so organic and just fully unfolded how it was supposed to for myself, which was beautiful.
Yeah, and I love like what you said in the podcast too about how you've continued it, because I think so much of Western medicine the last at least 70 years has very much been that potentiated illness model, or the pharmaceutical
Hmm.
industry and insurance industry. And honestly, most providers and agencies, are incentivized to keep people ill, keep people on daily medications and keep them coming back forever.
Yeah.
Like I haven't seen you in a long time.
Yeah,
And that's
exactly.
great.
And
You're
it was,
doing really well.
I really felt like I lived with this title, like, me having depression, me having anxiety, all these things was like who I was. And it's so refreshing to know that there's these alternative, medicines now that like you walk in and walk out and you're like, that is not who I am. This is just something that I'm dealing with in this moment. And so that was like a huge thing I learned through ketamine was like, no, this is just a symptom I'm having. This isn't who I am. And getting into that, like you're saying, getting out of the Western medicine world, it was like, okay, cool. Like, I don't have to just be this person that I'm being diagnosed as. And that was like really, really nice for me personally. Yeah.
Yeah, I love that. I think, I really do at this point in my career, I don't like any other diagnoses besides trauma. And, I talk
Hmm.
about that a
Yeah.
lot and everything's
Hmm.
kind of the sequela or coping strategy for that trauma, those walls that we build for ourselves. And getting all of the ego dissolution agents, I think, are kind of on the up. They're all kind of late stage studies. I know Jessica had talked about other ones. I think there's some potential pitfalls of those longer acting ones. A lot more amplified transference and countertransference. I'm a big proponent of the IV ketamine for a multitude of reasons. One, being the legality. Two, like it's the only version you can pause, which I think is super important and powerful for people to remember that they're in the driver's seat. And then
I got to ask a question about that too, about the IV, the pausing. Actually, I think it was Jeremy who wanted to ask this question, so I don't want to steal his thunder.
Yeah, I did have one thing that came up to me when I was, reviewing our conversation with Dr. Casey. I never did ask a question that seemed to linger. You talk about how it was originally the anesthetic, and it's a very good anesthetic for all the reasons that you noted in episode 3. But it's also now the mental health therapy. I was wondering what the actual difference of the administration of the drug is in those two cases, like what the dose difference is, and is the IV what they do in the surgery room also? And my real question is the people who are getting it as an anesthetic in surgery, are they having those hallucinogenic, psychedelic kind of experiences while they're unconscious in surgery?
Yeah, those are great questions. And so, ketamine's on the World Health Organization's list of essential medications as an anesthetic because it's so incredibly safe. But, a lot of people talk about it. It'll be on the first mission to Mars because you can give a big, heavy dose of an intramuscular dose of ketamine and do a C-section or do a leg amputation. Because unlike other anesthetics, there's no respiratory depression and actually supports your cardiovascular function. That being said, like you're giving orders of magnitude higher dosing when you're trying to induct in anesthesia. Like we start people or conservative dosing clinic, follow the APA guidelines, start people at 0.5 milligrams per kilogram over 45 minutes. And then, it's kind of the perfect ride for the music. The music is so important with the ketamine treatments. Like it's really, really paramount, as is the integration afterwards. Like what comes after is far more important than what actually happens during the ketamine.
So it's the same? Am I hearing that correctly?
Pre-hospital, they're giving like 2 to 5 milligrams per kilogram.
Oh,
so way more.
So
gotcha.
Yeah, at least 4 times as much for most time. Like sometimes
okay.
they'll give 1 milligram per kilogram. But weight-based dosing primarily, but ketamine's on pretty much every paramedics like pre-hospital box. They do a lot of like bone reductions in the operating room, and ketamine's like the best anesthetic, the best well-tolerated anesthetic in children because they're so used to like just kind of being out of their own way. The dissociative response, as is large animals like horses and cats respond really well to ketamine. So, it's kind of got a bad rap, but we're all mammals, right? And so like there's a similar physiology there. And so 2 to 5 milligrams per kilogram all at once intramuscularly, primarily like pre-hospital, to help chill people out. Especially when there's an opioid on board, opioid or benzodiazepine, there is a risk of that being potentiated. So then you get the increased risk of respiratory depression. But given by itself, ketamine is really safe. So like the Matthew Perry thing, like he was on Suboxone, right? And so he was taking an opioid, and then he was given way too much ketamine by his assistant injection, and he's going swimming by himself, which we don't recommend. So not to make light of that. He was suffering for a long time though. Sure. I don't know if anyone's read I read his book like a year before he died. And he'd show up to the friend set like after having drank like a handle of vodka. And so he's been suffering for a long time. Like, I wish him and his family all the best. And it's challenging. That's why we're here, right? Like there's a lot of people suffering out there. And this medicine has the capacity to really help people. It's a catalyst. It's not a cure. No silver bullet, million silver DBs.
Do they get those experiences though, the psychedelic hallucinogenic experiences during surgery at those higher doses, or does it just turn you off?
It's really chaotic. Like there's kind of 2 thresholds of dosing that I think are worth talking about. There's the psycholytic dosing. And so again, those walls, right? We want to let those walls down just a little bit, because we want to build it up safely. And you're very aware of where you are. You can talk through a lot of the situation. The other threshold that's worth talking about is the anesthetic threshold. And as you approach that, it's very chaotic. Really, when people get higher dosing of intravenous ketamine in my clinic, and honestly, like with the intrinsic response methodology, the how I approach treatment, I want people approaching that because you can parcel through like brutal childhood trauma as like shapes and colors, like that Inside Out movie where they're walking through the hippocampus and they turn from like their normal
Oh
characters into
yeah,
like
I remember
shapes
that
and
movie.
colors.
Yep.
Like that's how we're processing through trauma in some aspects during
And Leigh,
ketamine
that's how you
treatments.
described your
Hmm.
experience, I remember too. Like you didn't see like specific
Yeah.
things, but it was colors, right? So that
Exactly. And
makes
and kind of
sense.
going off of that, it kind of makes you realize like your ego has so much to do with parts of, well, every day, all day. But if you like introduce, like Casey was saying, this trauma in a different shape or form, it doesn't really even allow your mind to say, "Oh, I recognize that," and that's scary, and we can't look at that. It's just brand new, so it kind of is just like, "Oh,
Hmm.
there's colors. Oh, there's shapes." So you're not really judging it. You're not really like trying to take control over it like you probably would if it was in this therapy office saying, "Hey, let's bring up this traumatic moment and really have you think about it and really have your mind could just go crazy with that." And I just felt like in this way it was like, I don't know what I'm seeing. I'm not trying to decide what I'm seeing. And it was, healing in so many ways that, yeah, it was very different, very cool. Yeah.
And Sherry, you've experienced this too, right? I mean, I know that that's kind of the impetus behind why you're here, right? And creating this company and I love that too, by the way, about like any business, a lot of these founders and these new companies that we meet with, the reason that they create them is because they had a personal experience or something. Yeah, maybe you can talk a little bit about that too. I think that will help kind of
Yeah.
ground us a little
So
bit.
So when I want to say that Dr. Casey brought up a really good point that we actually do use ketamine in much higher doses, sometimes like 4 or 5 times higher doses, even in children. And when, at Enthea, we're talking to employers, that really helps break the stigma because there still is so much stigma around these medicines. And when people hear like, oh, this is the same thing you give to children in higher doses, it does make them feel a lot more calmer and accepting of like, okay, if it's safe enough to give to children in doses that are 5 times higher, I should be okay doing it in a therapeutic setting in a lower dose. So yeah, just really important point to bring up. And then as for my own background and personal mission around this stems from two things. One was less of a personal experience with ketamine and more the work I did prior to starting Enthea. So prior to starting Enthea, I worked on poverty reduction and lived in the world's poorest countries for just over a decade and built programs at the national level to help reduce poverty. But as part of that, I was just faced with the global mental health crisis, and I couldn't even do my work successfully because everywhere I turned, people were suffering from intergenerational trauma, intergenerational poverty, which leads to trauma, and all of these things that affect communities and doesn't allow them to heal. And so, really, I became really impacted seeing this firsthand and then seeing that there weren't really solutions that we could offer that are effective. So I started looking for solutions and started seeing that, oh, well, antidepressants are only really effective for 15 to 20% of people that take them, but 57% have moderate to severe side effects. And then I started seeing up to 60% of people with a mental health issue are treatment resistant. Like that's imagine how lonely that must feel to be suffering and feeling hopeless because even if you do manage to get treatment, it doesn't work on you. And so I was very committed to finding something that worked. And that's when I stumbled upon some innovative treatments like ketamine therapy and psychedelic therapy, and even things like transcranial magnetic stimulation, stellate ganglion block. Like there are treatments that are out there that actually get to the root cause that people don't talk about or don't know about or are stigmatized. And then on the personal side, it's actually for me seeing someone I really care about that had been dealing with a very traumatic experience that tried to take their life twice. And I helped that person get access to ketamine and psychedelic therapy and saw how after just a few sessions, they were better. Like it was like something switched. And they went from being in a completely suicidal state to being like a whole happy person in such a little amount of time. And that was really the motivating factor of, starting something that allowed more people to get access to these treatments and do it affordably and safely.
Yeah,
Wow,
I was gonna
that's
say, it
incredible.
reminds me, Dr. Casey, you even mentioned that like you had somebody who was in your clinic maybe, right? Who
Oh
essentially was
yeah.
like, I'm gonna take my own life and was like ketamine and it's amazing.
Yeah.
I'm
Well,
like,
I
put the
don't mean to
ketamine cape
laugh. Like if
on.
you're not laughing, you're crying, right?
Yeah.
Like I said, I worked in the inpatient units at both the community mental health center and the local hospital. And you see like basically you're just waiting for the storm to blow over. Like if you do
Yeah.
start a medication that's helpful, it's probably lithium or ECT or TMS. We do transcranial magnetic stimulation out of our clinics as well. And I'm a big fan of the stellate ganglion block. It's like a very localized version of prolotherapy, which is like localized nerve blocks that's been around in Germany for like 200 years, and really well used. And the stellate ganglion block is kind of like that downregulation of the autonomic nervous system, upregulation of the parasympathetic nervous system, and just kind of a reset, like a reset of that. Like again, I think that analogy really works well as like that fight, flight, or freeze that people live in, and just being able to like have that cellular level release that you don't always know what happened, and sometimes it's better to not know what happened. Like I like EMDR for the most part. Eye movement desensitization and reprocessing. I'm trained in that. That being said, it can be really activating for people to like talk about their trauma, and not very helpful. So many people come to us after having gotten treatment for decades, and they've talked about their trauma for decades. And human language is such a blessing, Chris, that huge reduction valve, so much of the human experience that you just can't describe with words.
Mm.
So yeah, it's been incredibly rewarding. I've mitigated probably like 5 inpatient stays now where people call me and they're like, hey, my kid or myself or my spouse, like they're like suicidal. Like it's either I'm going to the hospital or I'm calling because I've heard this is like really effective. And I'll see people at like 10 o'clock at night sometimes. And like again, it's such rewarding work coming from
Mm.
because they'll be like, oh my God, like I had one client, and she was sure it was going to be like her husband beating her ex-husband as one of her traumatic memories. And she was like, and it went back to my mother and she was choking me and she started crying and crying and she was like, and I just recognized that she loved me so much and she was doing the best she could with what she had. And she just had such deep forgiveness for her mother and all the trauma that her mother went through to think that that was the best option. And it's just like these types of releases, like you aren't going to see with sertraline, right? You aren't going to see with fluoxetine.
Right.
And I think Jessica touched on it as like, decades sometimes of therapy to feel safe enough to be able to kind of process through that.
Hmm.
Yeah.
Leah, I'm sorry I cut you off my question. You were going to share something, but and especially after what he's just shared. Now I know that, your situation wasn't quite like that, but
Mm-mm.
um, I mean to kind of touch on what your experience was and maybe even, just referencing, that others have gone through ketamine
Hmm.
therapy and they've been successful. Like, what can you tell us about that? Like, what can you share about what your experience was and how that the outcomes were for you? And do you feel like it saved you? I mean, I don't know if that's the right word, but
Hmm.
yeah.
Well, it's like I feel like when you are diagnosed with something, it's like a relief in a way where you're like, okay, so I this is real. I'm not making this up, and other people have this, other people are suffering from this. I'm not alone. But then it's like it's the medications and stuff. Yeah, it's like, oh, well, just take this medication, it'll make the symptoms go away. And it's like you just always have that voice in the back of your head that's like, okay, but like how do we fix this problem? Or at least that's how I felt. And so I went for years and years just being like trying to convince myself that it's okay that you're this person now, and it's okay that but I never really could accept that answer. And I think kind of what Sherry was saying, like with all the research done, like a lot of stuff, the pills, the blanketed responses to when people have been diagnosed with something, they don't always work. And so in a way, it's really wonderful that, ketamine is kind of this scary drug in a sense, but there's so many people that they have tried so many different things. You get to a point where you're just like, I surrender. Like, just give me anything, like anything new, anything. So that's what's kind of nice about it, I think, at least this at this point is, it is so different, but at the same time, there's so many people that they've kind of tried everything that just seems safe, that just seems normal, that just seems, like comfortable, that doing something extreme like this, unless you've experienced, feeling suicidal, unless you've experienced like the deep, pain that comes from one of these, diagnoses, we'll say, you're at a point where you're just like, save me, anything, I'll try anything, I'll try anything. And a lot of times I'm sure, it still wouldn't even be a yes, but it's just so great that we have these clinics now, like Dr. Casey's, that you can still go in there and feel safe and feel protected and feel legal and feel, that you're still doing the right steps. But I think it's easier. I think it's easier now to say yes to something like this because of everything we've been offered for the last 10 plus years. It's just never been enough, or at least, for a lot of us, it hasn't been enough. I mean, I know the pills were first kind of given to people to be like, this is something you can use for now to get you past this moment in time, and then you'll get off of them. But it just never quite worked like that. All of a sudden, it was like, nah, you're just going to be stuck on these the rest of your life. And so, yeah, I just like, I will say in a way it saved me. I like to use it as like my stepping stone. I don't want to, discredit all the other things that got me through my hard things. I've had a very good therapists. The antidepressant medications and stuff I have been on, they have helped, but ketamine was kind of the first like real breakthrough that it was like, holy shit, like I actually see through now. I'm not just like having to do this like repeated thing every single month of like, well, I'm a little sadder this time of the month, or even through the year. It's like, oh, it's winter, so I just have my winter depression. Like I was just sick and tired of trying to like make sense of it and accept all of it. And
And
ketamine was like
justify
the
it,
first thing
right?
that I was like, wow, like this
Yeah.
worked. I can see through it. And so
Hmm.
that was kind of my experience. Yeah.
Yeah,
Yeah.
and I'll just add to that,
Mhm.
to sort of like paint that picture. One, I know I talk badly sometimes about prescriptions, but I know that they do help people, and sometimes that's all you have.
Yeah,
And
absolutely.
for some people, they help a lot. And now we at Enthea, we've been analyzing all this claims data when we partner with employers, and we see that actually 30 to 40% of people on SSRIs have to take an additional medication just to manage the side effects. And
Mhm.
20% of them are doing that in the first 3 months. So the side effects are so severe that in the first 3 months, they have to take another prescription, and people are dealing with side effects. The most common one is sexual dysfunction, then weight gain, insomnia, brain fog. Actually, SSRIs then can cause increased anxiety, like GI issues. So, and then long-term use of antidepressants can sometimes cause suicidal thoughts. So the exact opposite of what we're hoping for. And
Mhm.
again, I know they
That's
help some.
bonkers. Like,
Yeah, and
Yeah.
I say this
really?
like I know they help some people, and I'm like, I'm
Yeah.
so happy that when they do help some people, but I don't think
Hmm.
enough people talk about these side effects. And the thing that blows my mind is, if we look at over the past 10 years, we've increased our antidepressant prescriptions in the past 10 years in the US by, I think, like 35%, but the rate of depression in the past 10 years has doubled. So,
We're
like,
clearly
I
not
don't
fixing it.
know.
Right.
Like, how does this make any sense? Like, it just,
Right.
so
Make it
anyway,
make sense. Ketamine.
yeah.
Yeah. Well, and you have this medication that one size doesn't fit all. And what I really enjoyed and about like the ketamine and probably the other types of, even like I think mushrooms are kind of this new thing
Psilocybin?
too, is I feel like they're kind of just smarter and they work with the individual, how the individual can handle it. Like my experience was completely different than somebody else's, and that was for the better. I don't know if I could have handled to have the real life people in one of my sessions where it was like the medication, the ketamine worked with my own brain saying, oh, this is what she needs. This is how she needs to receive this. And it's like almost like that. It's like it kind of, for everybody, it's going to do something a little different, but it won't be like a side effect. Like a medication would give you a side effect. And so that's what I kind of noticed about it too.
That actually leads me to a question for Sherry. You said in your little bio at the beginning there you were a member of the psychedelic research group or something like that. And I know
Yeah.
you're actively working in the ketamine space. Are you working with like psilocybin places in Oregon and ayahuasca centers in DC and all those other things that are starting to come up? Are you in that area as well?
Yes. So we are offering psilocybin to employers in Oregon. And that's not just for employers who are based in Oregon, it's even for employers elsewhere that like are okay paying for their employees to go to Oregon for treatment. So we do offer that. And we'll probably do the same in Colorado soon. We haven't looked into ayahuasca. Maybe you've mentioned something that I'm not fully in the know about because it's hard to be in the know of everything, but I'm
They
definitely yes.
I know they have centers in Washington, D.C. where you can go get ayahuasca treatments, like totally like the ketamine clinic, this psilocybin clinic, same concept at work, but it's ayahuasca.
Is
I'm
it
not sure
maybe
if
through
it's anywhere else, but I know it's in DC.
maybe it's through a church because I don't think it's made available legally through a in a
Ah,
therapeutic or clinic setting, but there are churches that are able to offer ayahuasca.
Maybe that's what it is.
interesting.
Yeah.
Dr. Casey, I'm curious too, because you being a clinic, provider, and obviously doing some of the other alternative, do you hear about this kind of thing? Are people talking about it? Your patients asking about these things? Are they saying they're going on ayahuasca retreats in Mexico? I might know somebody who did that, who I want to bring on the show.
Yeah, very much so. And again, I want to reiterate my belief that all ego dissolution agents work the same to some extent in that they're letting the walls down safely. Everyone's walls look a little different. Some people's walls are depression or anxiety or substance use disorder or even bipolar disorder. Like those coping strategies that we build on purpose to protect ourselves look different for everyone. Like I worked in the community mental health center and you look at those street schizophrenics, right? Those people that are yelling and screaming at themselves on the street. You look at their adverse childhood experiences score, and they're pretty much always pinned. So like the worst childhood you can imagine. And with that, like my view, again, the only real kind of diagnosis is trauma, and everything else is kind of a coping strategy for that trauma, and trauma is very subjective. And so, yeah, ayahuasca, psilocybin, MDMA. MDMA is probably the best well-tolerated ego dissolution agent in a large swath of the population because it's an empathogenic versus a psychedelic. I would
What does
argue
that
that
mean?
ketamine,
Im-
empathogen, so like you're
mhm.
plugged into like feeling safe. You don't necessarily have a bunch of perceptual distortion that can
Okay,
occur with traditional psychedelics.
gotcha.
Again, I'm going to steer everyone towards IV ketamine first for these 5 reasons: best bioavailability, straight to the source, 95 to 99% efficacy or bioavailability. Efficacy profile, the first trauma study that I'm aware of with ketamine, like late 1980s in a teaching hospital in Russia. And ketamine clinics for mood disorders have been around since the late 1990s. 70 to 95% effective for mental health disorders, 95% effective for suicidality. So the efficacy is bonkers, right? And then third, it's safest. Like so with ayahuasca and psilocybin, you have a shaman or someone who isn't doing a very good vetting. You got a risk for serotonin syndrome. And a few people die per year of serotonin syndrome because they don't tell the shaman or whoever who's running that kind of ceremony circle isn't aware that what they're on is serotonin modulating in some way. And so there's a danger there that doesn't exist with ketamine at all. Fourthly, again, only version that's legal. And fifthly, and I think this is super important, particularly for those with trauma, it's the only version you can pause. So it really keeps people in the driver's seat. Again, this is something I want to be really aware of. There's a lot of pitfalls of longer acting ego dissolution agents. And so like when you're looking at psilocybin, 10 to 12 hours for some people, you're looking at ayahuasca, 8 to 12 hours. You're looking at ibogaine, like 22 hours. There's a
Oh, wow.
derivative from Hamilton's Pharmacopoeia, 72-hour ego dissolution.
I
Way
didn't
too
know it
much
was
in
Whoa.
that
my opinion.
long.
72 hours?
72 hours. Yeah, they lab derived it, but
Just
it's
the
out
thought
there
of
and
that,
people
like,
do
That's
it.
a long trip,
Yeah.
man.
Right. Yeah,
oh,
too
good.
long.
Way
And
too
and
long.
that's like what Lycos Therapeutics, so the spinoff from MAPS, got in trouble for is like they try to mitigate some of the risk of ego dissolution in that really amplification of transference and countertransference that like me reminding the client of someone from their past and the client reminding me of someone from my past. And the long and the short of it is like we're showing up to work and sometimes I'm 40% of the clinician I could potentially be, right? Like I'm dealing with stuff at home, I'm tired, I'm fighting something. Um, and when you're super plugged in, like you can't do the intrinsic response methodology for that kind of duration, which is that whole premise of you'll always be your own best healer. You cut your hand, I put a band-aid on it. I'm not healing it. You're still healing it, right? And so those 8 to 12 hour sessions, like there's like a lot of re-traumatization that's happening, particularly like in the underground. So like someone will do a psilocybin journey with this shaman person, and then they'll they'll enter a sexual relationship with them, and then there'll be a whole nother kind of layer of their trauma on top of the trauma, because it's just too long to be kind of in that state with someone who's bringing their own trauma into like we all bring our own trauma into every interaction, right? And so I think it's important to be cognizant of that. If we don't learn from history, we're doomed to repeat it. There's a huge energy right now about all the psychedelics, all the ego dissolution agents. And 1960s, 1970s, very similar energy. And they were curative for depression back then, curative for panic disorders back then, curative for alcoholism, curative for trauma. And then, in my opinion, at least part of what happened, a lot of the researchers, a lot of clinicians started kind of touting it as a panacea, touting it as this cure-all, and started joking about putting the water supplies sneaking into politicians. Then lost their credence as non-biased researchers, non-biased clinicians. And then, when the inevitable kind of other foot dropped of the public perception and like, I don't know about all this, those researchers, those clinicians didn't have any legs to stand on. So I think it's really important that we be very ethical with our delivery, and really mindful of that as, kind of we keep moving forward, and particularly with those long-acting ones like psilocybin, like ayahuasca, pretty much anything is going to be longer than ketamine. There is like a derivative psilocin, so they derived like an active, and this is compass pathways, and they're looking at an intravenous delivery model. Part of the pharmaceutical startup that I'm a part of, Epic Biosciences, there's some mitigation of some of the psychedelic properties. So there's some interesting stuff going on out there. I just want to bring that into the mix, the conversation, because I think it's important.
Wow.
Yeah, we're interested in it too. So,
Yep.
it made me think too, Sherry, about the work that you do. We're talking about kind of how ketamine has become more mainstream, right? And a lot of it, Dr. Casey, you've been saying is that it's a little bit more controllable too, versus like, hey, go on a ayahuasca retreat or whatever it is. What kind of challenges or barriers do you face with like talking to employers about bringing ketamine clinics or the network of ketamine clinics to their employees? Is there pushback? Like, is it getting easier?
So I would say that when we started in Thea, we spent a lot of time thinking about how to deal with the pushback, about education, about, really like trying to reduce stigma. We still have to do that, but things have changed a lot, I would say, in the past 2 to 3 years. Like Enthea started, almost 6 years ago. And to be honest, when initially I was scared to tell my family that I had quit my like fancy international development job to like work in the psychedelic space. I wasn't sure how they were going to react. And then funny enough, when the How to Change Your Mind documentary came out on Netflix after Michael Pollan's book, like we had a whole watch party with my family. And so that kind of tells you from a personal experience how the tide is sort of shifted. And even when talking to employers, like people have maybe seen the thing on Netflix or maybe seen the shorter episode on Netflix, The Mind Explained. There's a great episode on psychedelics, or maybe heard Joe Rogan talk about it, or Gwyneth Paltrow talk about it, or Elon Musk talk about it. Like whoever is in your algorithm, probably someone has talked about ketamine, and more broadly psychedelics. It's been on 60 Minutes, it's been on Fox, it's been in the New York Times. So as long as you're sort of consuming some sort of media, you've probably heard about this. And that's really helped shift the conversation. You have a lot of athletes like Aaron Rodgers, Mike Tyson, Lamar Odom. Psychedelics was on the cover of Sports Illustrated. So the conversation really has shifted. And so when talking to employers, that has helped a lot. The other thing that has helped a lot is, unlike when perhaps people in other industries are selling other types of benefits to employers. Maybe they're selling like vision or dental, which
Same old,
yeah,
right?
like right, like
Yeah.
it's like it's. I don't want to like. I'm sure that's like very difficult work because it's kind of a little dry. Um, when we're talking to employers, what we've noticed really helps is just resonating on a personal and human level with the person we're talking to, because unfortunately chances are they've dealt with a mental health issue. And if they haven't, for whatever reason they haven't in their life, for sure someone they care about has. And they can really resonate when we talk about how traditional methods probably hasn't helped them or that person they care about. And, that person that they care about, or they are still on pills or still taking prescriptions or have been in therapy for 10 or 15 years and, not feeling better. So the conversation has definitely shifted. I will say that there is still a lot of stigma around psychedelics. So we at Enthea changed our website and changed a lot of our sales materials and started saying like ketamine, TMS, the Stella Ganglion block, innovative mental health therapies, and removed a lot of the psychedelic verbiage because we could tell people weren't ready for that yet. And hopefully that will change in the next couple of years, and then we can start using the word more, but I steer away from using that word when talking to employers.
Like more clinical. And also like Leigh, I feel like stories like yours, right? And having that voice and, being an early adopter, and getting other people interested in it, that helps take that stigma away, making it a little bit more mainstream. So,
Right.
yeah.
Yeah,
Do you feel
absolutely.
like that you've had that kind of impact on people too, by being like,
I
hey, I
Yeah,
did
I
it.
do. And I
Okay.
think like for anyone that knows me personally, I'm not, labeled as someone that you might label someone that would be interested in trying some type of new drug or something. So I think that really helped too. Like everybody that knows me knows I've never done drugs. I was never that druggy in high school. I was never that experimental type girl. I'm not a drinker. Like, so I think that too. It was just, they're like, oh, well, Leigh's so innocent and closed-minded. If she can do it, I can do it. It's kind of how I feel like I came across to a lot of people. So, but it was helpful,
Yeah.
And
You
I got a lot
said
of people that would say, well, aren't people going to take advantage and just go do sign up for ketamine just so they can have, the experience and the trip? And I was just like, well, no, because
And that's not how it
it's
works,
just,
right,
yeah,
Dr.
it's like, no, they
Casey?
can just get their street drugs from the street, I imagine. But like, yeah, so I think that too, just being honest about it, I think you could actually see it in me. Like it was the first thing that I was like, oh my gosh, this worked. So it sold itself. I wasn't that big of a salesman for it, but I think it did help that I was kind of just your average mom, next door neighbor,
Sure.
kind of person. Yeah.
In your initial episode, you said that you had spoken to other people, your hairdressing clients and whatnot,
Yeah.
and kind of steering them that way. Have you had anyone come back with like, oh my God, thank you so much for sending me to Dr. Casey kind of thing? Have you heard success stories from other people that
Absolutely.
you referred
Yeah,
into?
absolutely. And actually, I think one of somebody that I sent to him has interviewed with him. Her name is Ashley. I'll just name drop her on here. But yes, like absolutely. Because it's one of those things, it's if it works, it works. You're gonna tell people that it works, you know?
The domino effect. You get one person
Absolutely.
talking about it. I always
Yeah.
say I was an early adopter of MIDI health around perimenopause, and I got like 5 or 6 people, friends of mine, to sign up for it, and I like scream it from the mountaintop. So like the
Yeah,
second you can start, it's like creating ambassadors, right? We have like
absolutely.
ketamine ambassadors. So and then
Hmm.
Dr. Casey
Absolutely.
gets more patients and gets to do more of his good work.
Yeah.
Yeah. And then
Yeah, no,
gets
I
to connect with
appreciate.
folks like Sherry and,
Yeah,
it's like
absolutely.
what a great domino
Yeah.
effect that is.
Yeah.
Yeah, I have to joke that I'm just a selfish guy because I know what's good for my clients is good for the universe, you know?
Hmm.
And so like when people are like, because when people come to us and they're trying to fill up their cup from below, it's like, I've almost got it. It's like,
Mm.
no, let's take that time to write that
It's an
cup,
interesting metaphor.
Yeah.
Right,
Yeah.
yeah. I see it all the time. One thing I think worth mentioning, just there are a lot of places out there that are doing ketamine now. And I think it's
Mm.
really important to do a vetting because, again, we all do our own kind of bring in our own trauma into every interaction. And so you want to, wherever you're going to work with, like, and I don't care if it's me or someone else, I just want you to make sure that you're doing a vetting. And there are some like national places too that are providing like at-home ketamine, very accessibly. And one that's even like advertising injectable ketamine at home, which I'm not a fan of. I think that you need oversight. And this is one of those things that I think need to be in the discussion is like, hey, like, you may get it cheaper. Um, and like that's not the way to go about it. And
Mhm.
so like I think it's really important to have like local support. I think it's
Yeah.
important to have a place to go. And you look at like MindBloom's website, that's one of the big at-home ketamine providers. And they
Um,
say like in their disclosure thing, like we are not prescribing your ketamine. It's contracted with the medical providers, so we have no kind of oversight or no litigation. You can't sue us at all. And they're like actively advertising at-home ketamine. Like I heard at the American Society of Ketamine Providers conference that I was just at a month ago, that with like someone's teenager was, caught buying or selling Mind Bloom ketamine at a high
No
school.
way.
And so
Really?
yeah, and so it's unfortunate. Like, there's no physiological dependence with ketamine like there are with opioids or benzodiazepines. That being said, like just like working out or dopamine doom scrolling, like you can get addicted to the feeling, and people try to live there, just like with the walls down. And so it's important to recognize, like, as much as possible in Western medicine, we like to deliver these treatments as sacred and that we're giving them on purpose. And so we really want, to emphasize the need for integration. We want to emphasize that, like, this is a non-specific amplifier of the human experience. All of them are, and no one needs them. And they can help things move quickly. And really that setting and sustainability are so important. And so like all those things are I was like,
yeah.
I'm like the naysayer today. I'm like, oh, and then this is like, oh,
Well, and
geez.
going off of what you were saying, Casey, is like, I feel comfortable and confident.
Yeah.
Yeah.
Well, you want to feel safe
Yeah.
and,
Yes, I
you
feel
know,
confident sending people to your clinic because I know that it's safe. I know that it's, like they're gonna be safe there and you're gonna take care of them. Where if I did get it just off the streets or something, like I couldn't even trust that resource. So that's what's nice about having this safe place to actually send people to. So
Yeah, and
Totally
yeah,
I'll
agree.
just
yeah,
I'll I'll just add on top of that. I completely agree with the importance of, selecting a provider wisely. The most common thing that happens when I speak at a conference is actually after I speak, someone comes up to me, at least one person, and they tell me they either had a bad ketamine experience or know someone who had a bad ketamine experience, or they are too, like, they really want to try ketamine therapy, but they have no idea where to start because they're scared. They really, it's hard to figure out which one's good. If this is not your area of expertise, just Googling ketamine therapy and your city is not going to yield great results. And so, a couple more things to actually say on that, because I think it's such an important point. At Enthea, we actually spent 2 years just building a process to vet and credential providers before even going to market. Like, that's how serious we took it. We didn't try to talk to employers or sell to employers. We consulted with some of the world's leading ketamine therapists and tried to figure out what is the gold standard, and how do you figure out who meets this criteria and who passes the test. And hopefully we'll have Dr. Casey on board. I would really like that. But that was like a really difficult process for us of, figuring out this credentialing process, and then, continuing to update it and review the data that's out there. And I'm with you with the risks of at-home ketamine or at-home injectables in high doses, like at-home ketamine in high doses without protocols, or at-home injectables concern me quite a lot. But I'm also, to be fair, really worried about these ketamine clinics that don't provide any psychotherapy, just give you an IV of ketamine and be like, okay, well, go home after and we'll never talk about what happened or how this worked or if it had any effect on you, which is also quite common. You have a lot of clinics where you just have a nurse on site that's administering ketamine and there's no psychosocial support. And so, yeah, just things that are definitely important. Safety is, something that could break this industry. We have something that, could really revolutionize the way we treat mental health. But if it's not in a safe container, it could go the other way. A couple of weeks ago on LinkedIn, I just did a post saying, hey, if you don't know where to start and you want to find a ketamine therapist, or you want to learn more, like, I put my cell phone number and I said, just message me and I'll help. And I got like 72 texts in just
Oh
a
my
few.
gosh.
Yeah.
Wow.
And so, like, people are curious and they don't know where to start. So, yeah.
I think of you as and this is me putting my kind of health plan hat on from where I spent a lot of time, and we had centers of excellence, which was like specialties within kind of like our provider networks, like cardiologist or bariatric or therapist for that matter. And like it was almost a plan design to steer our patient or our members into these what we would call centers of excellence, was we're really like kind of the most highly vetted, best of the best providers in that space. And so it seems like what you're doing, Sherry, it's like you're like a center of excellence for ketamine. And so if Dr. Casey and Revitalize are part of Enthea's network, then you get like it's like the gold standard. So yeah. So good job,
Yeah, I just
everybody.
want
This is great.
to piggyback off of that, like just how important integration is. So like I created this whole workbook for people. Like my background's eating it up, but
Yeah.
it's like a 40-page workbook on, how to really take care of yourself. Like, like that sled track analogy. Like people come to us and they've got these sled tracks of depression, anxiety, suicidality that have been whittled into, toboggan trails over decades. And within 2 or 3 minutes of starting a ketamine infusion, we see new dendrites forming on a functional MRI, that ability to quite literally change your mind. And if you don't change anything else afterwards, you're probably going to go back down this same sled track. Right? And so when you do that induction series of 6 infusions with the 1 month booster, you get like 5 feet of fresh fallen snow. And so it's so important to take advantage of that period and, kind of energy in, energy out. And we do like in-person integration groups at each of our physical locations once a week at no extra charge, because I think that is so important to have a safe place. Because most people who do these treatments, they don't have anyone to share that kind of experience with, and that can be so helpful in kind of completing the cycle. And so we do 4 groups a week, 1 in each of our physical locations that I run with an integration specialist. And then we do an online one to just increase access. Because again, integration is so what happens afterward. That's where the rubber hits the road. And so, not a panacea, not a cure-all. It's that catalyst, not a cure. And it's an amazing catalyst. Oh my gosh, the amount of like things that I see on a daily basis, so rewarding. Yeah, I appreciate you all.
Yeah, Lee, you said something when you were talking earlier. It wasn't the word catalyst, but it was, I don't know, it was something, it was like a breakthrough for
Hmm.
you. Yeah,
Yeah.
so
Yeah.
ketamine's got
It's
a,
real. It happens.
yeah.
And I think like there was a few people that I had sent, and I think they had done like one treatment um, from, I imagine it's still the same, but Casey was like, you should do six in a row. And if someone does only one, if yeah, they're kind of like ego gets involved, they're like, this is too weird, this is too scary, I don't like this, and then they just kind of wouldn't go back. And so I think that was more like the only negative feedback I got from it was they were kind of just holding themselves back from fully, accepting the treatment itself. So that would be my advice is to just commit to the full, you know, all six treatments if that's what's recommended for you and not to kind of give up on the first or second one. Because even for me, I could tell that I was holding back or I was creating my own blocks, the first couple times. And then you get kind of used to it. And that's when you like can kind of let down your guards and just be like, oh, wow, okay. Like this is a little more, acceptable. So,
Yeah, I love that. Just to
Huh.
build on that, like I think it's important to recognize like I think we all talked about, how tamped down that emotionality can be, especially when you're taking daily medications for a long time. So I'm seeing like probably 10 to 30% of people in that series of six get a little worse before they get better because you're actually opening this Pandora's box of
Mm.
things that have
mhm,
been shoved way down. I like to tell people it won't come to the surface unless it's safe to come to the surface. And that's why
Mhm.
integration is so important. Most people, it's sunshine and rainbows and a really positive experience. Some people, it sucks. Some people, they don't like
mhm,
it. And
mhm.
that I agree with Leigh, obviously, is that's where we see the life-changing results. It's that series of six.
I'm so glad you said that, Casey, about the 10 to 30%, because that's another thing that worries me when, people have to pay out of pocket and they can't afford to pay out of pocket. And this isn't covered as an employee benefit because people then drop off. Like things got worse, it's not getting better, and they're paying out of pocket and they might not be able to afford it. And why would they want to like squeeze squeeze their budget and save up extra money to pay for something that in the moment doesn't feel good? Um, so yeah, just honestly, like even if it's not through Enthea, for whoever's listening, that's an employer, like it's really something to consider covering because it's sad if people are left in that situation as well.
Mm.
Yeah, if I
Yeah.
would have given up after the second treatment, I never would have gotten to where I am now, never. So,
I'm glad you stuck with it.
yeah, me too.
And the fact that, Leigh, you said yourself that you did not enjoy the treatments, but they did so
That's
much
true.
good for you that
Yeah.
it was worth going through. So that,
Yeah,
I mean, that
absolutely.
right there to me is almost the best,
Mhm.
the best example of why you should do it. Because even if you don't enjoy it, it's still going to give you the good results.
Yeah.
Right.
So
Absolutely.
It's like remodeling your house.
Exactly.
I guess.
That's what I think about, and also, it's like the feeling, kind of the pain before the good part comes. It's kind of like any new habit, right? It's like getting to the gym. It's like starting a new way of eating. Like it kind of sucks at first, but like power through or quitting, right?
Mhm,
Like quitting alcohol or quitting smoking or whatever. Yeah, those first couple of weeks are just gonna be gnarly, but if you
mhm.
stick through it and you commit, like anything, you hopefully go out. Well, particularly it sounds like with ketamine, you're gonna end up with sunshines and rainbows eventually, right?
Yeah.
There you go.
At least that's what we hope. Well,
Yeah.
we are, we're just wrapping up here, guys. This has been such a great conversation, and I think this is such a great spot to end on. Um, all good positivity. Ketamine has a place, in mental health and clinical treatment plans. It's not going anywhere, and in fact, it's probably just going to keep growing, right? And I think it's people like you guys here on this roundtable that are going to be a part of that growth, and hopefully
Yeah.
using this platform, we'll get it out there in the universe to be a big cheerleader for the work that you all are doing, and Leigh, for you being honest. Thank you. I think as particularly for you as a patient, to bring this kind of vulnerability and this honesty to this
Yeah.
is really important. So,
Well, and I'm just so grateful for people like Casey and Sherry that like this is a new opportunity. Like it's life changing. It's amazing. I'll forever be grateful like for this opportunity because this opportunity was not available to me, a couple years and farther back. So I am just like so grateful for that. I'll scream it to the rooftops just for that reason right there that
yeah.
it's helpful. It is.
Yep.
Okay.
And this is why we do this, right?
Yeah.
Is to help people like you, and because
That's why we call it the uprising.
that is correct. This is why we call it the uprising.
that.
So thank you all for joining us on the roundtable, our first roundtable ever. Very exciting on
Yeah.
ketamine. Really one of the
Fun.
most interesting topics I think around right now. And just alternative mental health therapy is just going to keep changing and changing. So yeah. So
Just getting started.
just getting started. Love it. Thank you
I
guys
like
for
that.
being
Yep.
part of this. Yeah, this has been a great conversation today.
Thank you.
Thank
Thank you.
Thank you so much.
Awesome.
Thanks.
Thanks, everybody.
And there you go. A successful conclusion to our first ever roundtable discussion episode. Sad to see the ketamine therapy come to an end, but I think we've covered it as much as we're going to be able to. So, but what's our main takeaways from all this, Heather?
Well, I mean, like the most obvious thing is just fascinating, right? To bring all these people together to the roundtable to start really getting a full picture of what it means to have access to and benefit from ketamine therapy. You've got kind of all the main players. I don't think we're missing anybody, at least not yet. But it reminds me of the movie The Big Lebowski.
Oh,
That rug, it really tied the room together, just like this roundtable event.
oh, nice, nice. As a Dudist monk, I greatly appreciate that.
I thought you would. I
The,
thought you
the
would.
producer abides, man. The producer abides.
And the host abides. But yeah, it's I had to find a way to use that. But finally, yes.
That rug really tied the room together.
It really tied the room together. But alternative mental health therapies, like legit on the rise, ketamine clearly leading the way. We definitely touched on some other mental health therapies that are a little bit less known, maybe not quite as mainstream yet. And I'm not even sure if we can call ketamine mainstream quite yet. It's like super close, but it's people like Dr. Casey creating these clinics, these safe places. Anthea bringing it to literally like companies, right, who are
Yeah.
truly legitimizing the power of it, and then having folks like Leigh who are screaming from the mountaintops, creating these kind of ketamine ambassadors out there. Like it really works, and it's safe and it's effective, and so you need kind of all of them. So
Yeah.
all the characters.
And they're everywhere. Look up, go on your map app and type in ketamine clinic, and there's one near you.
Yeah.
Like I consider that being mainstreamed, no doubt.
Yeah, it's like on
Like
the corner of Main Street.
The clinical side of ketamine, you know
Yeah.
what I mean? Like you still don't want to go buying it on the corner like that. But
Yeah.
the ketamine clinics, I feel, have totally become mainstream.
Yeah.
It's everywhere.
And truthfully, and a lot of people that we talk to on this show, and even just, people in my, healthcare universe, if there is one area within healthcare that needs the most attention, and we see the most growth potential in terms of like services and programs and the ways that we can really treat, different medical conditions, mental health is like number one, like without a doubt.
Oh,
So depression, suicide, PTSD, like all of these things, like they are not going away. If anything, they're probably increasing, particularly since COVID. So, mental health in that space, I mean, it is just ripe for new ways of doing things.
Yeah.
So ketamine has its place.
Definitely need an app for that.
We need an app for that.
But yeah, but that was great. And it's really the first conclusion to any of our arcs so far, which is
Yeah.
kind of cool. And we'll see what we get into next. We're gonna have to find the next step down the road that ketamine has put us on. But until we figure that out, if you could just take a moment to hit all those happy little fun buttons on whatever platform you're on, the like, subscribes, the shares, the ring the bell, follow, the auto download is a lovely one on those audio platforms. We're also on YouTube, so you can watch us, you can listen to us. If you really like it, you can check us out at patreon.com/healthcareuprising, where you can support us and join the uprising officially for as little as $1 a month. It goes up from there. Really appreciate any support you can throw us. But biggest thing is hit that like button, everybody, because we just want to know you like what we're doing. Leave us a rating and review. Tell us what we're doing wrong. That helps just as much. But where else can they find us, Heather?
You can find us online at healthcareuprising.com. And of course, all of the social media platforms like LinkedIn, Facebook, Instagram, and Blue Sky. Just search Healthcare Uprising Podcast and you'll find us pretty easily. We're fairly active out there. Definitely post all of our new episodes. So definitely follow, like us out on the socials. Also, if you're a new business, a founder, somebody who represents a company that's got a new product program somewhere in the healthcare space that's innovative, give us a shout. Email us at healthcareuprising@gmail.com. That also includes human stories. So you got a human story, something good, bad, ugly, otherwise, email us. We'd love to bring you on the show and hear your story, because that's an important part of the fabric of healthcare uprising. So
Absolutely.
Yeah.
I like the stories that have the good, the bad, and the ugly all at the same time.
Some of them have all. But that's it for today's dose of healthcare uprising. So until next time, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.